So I'm Natalie Brown-Kennedy, Clinical Lead for the Hampshire and Isle of Wight Staff Support Hub. So working for Southern Health NHS Foundation Trust, and the Staff Support Hub covers the Hampshire and Isle of Wight ICS. So it's hosted by Southern Health Foundation Trust, but on behalf of the ICS. So the Staff Support Hub has been set up as part of a national initiative to support NHS and social care staff that have worked through the pandemic, and we offer rapid clinical assessment, so helping staff to access services that they might need and support that they might need. We recognise that using words like mental health has had an impact on people accessing services, so we've changed that to have more of a conversation, encouraging people to get in touch to access some support. Also working with whole teams, so we support individual members of staff as well as teams that might need support, seeing themes like burnout and depression, as well as people presenting with trauma. We've set up like our own kind of record system so that staff have greater confidentiality and they feel assured of that and have fed that back. And we've been measuring outcomes through staff feedback, as well as through questionnaires, so outcome measures such as the PHQ-9 and the GAD-7, which help to measure people's levels of depression and anxiety. We've also been filling in patient experience questionnaires when people have completed a course of treatment or completed some sessions with us. And we've set up the service so from scratch and developed referral pathways into other services across the ICS. So IAP services, secondary care services, and that's had its challenges, as setting up any new service does, and making sure that those pathways are in place. And we've had challenges around the timeframes that people have been able to access the support that they need, but have been working with partner organisations to try and ensure those processes are in place and people can access the support that they need within a timely manner. In terms of things, if we could build on what we've been doing, that we would increase maybe what we could offer within the hub to include more treatment, so that we could then wrap care around the staff rather than kind of trying to work with the barriers that services we're coming up against with other services. And we recognise kind of coming into the winter that we might see like another wave with the pandemic and COVID numbers perhaps rising, so that might present further challenges for staff that have already dealt with the different waves of the pandemic. And just to let people know that we would continue to support them and we'll be here to support them. And there's resources on our website that we've set up, and the website address is www.hiowstaff.nhs.uk. People can refer directly through the website as well, either for team support or individual support. And there's a resources section which we update frequently with useful resources. So following the clinical assessment or the longer conversation that we might have with people, we might offer up to 3 additional sessions within the hub if somebody is unsure of what support they need, or if they're unsure about having, say, psychological therapy. We might offer that within the hub to help people to engage, and people fed back that that's really useful and that we tailor the support to their specific needs. So it's really an opportunity for us to individualise the support that we're offering and tailor that specifically to each person that's coming through. And the staff support that we offer to the whole teams, is also very bespoke and very focused on what that specific team needs. In terms of offering the clinical assessment or the longer conversation, we use a trusted assessment model, so that when we're talking to staff, we do the full assessment and find out the full picture for them, so that when we then consider which service would be helpful, if any, to refer them on to, that they're then not having to repeat that process and go through another assessment, because some of the feedback that we've had from staff is they would go to different services and just have lots of assessments So with having the trusted assessment model, we can ensure that those pathways are more seamless and that we're kind of handing people to services to help support with that journey, and also make sure that they're not telling their story lots of different times to lots of different people. And people have fed back that that's been really helpful.